The GHA Director General, Dr. Patrick Geoghegan, says he is saddened and disappointed by recent acts of aggression directed towards GHA staff. He says the Midtown COVID-19 testing facility, elderly residential services and accident and emergency have all reported multiple incidents of verbal abuse and threatening behaviour by members of the public in recent weeks. The GHA says it will continue to enforce its zero-tolerance policy towards such repugnant acts. Any incidences of aggression towards GHA staff will be reported to the Royal Gibraltar Police for investigation. Joining us live in the studio now is the Director General himself, Dr. Patrick Geoghegan. Thank you so much for joining us.
Good evening.
Good to see you again and welcome to your role. You've officially taken on.
Thank you very much.
Let's get straight to it.
Of course.
Please describe these abusive acts towards staff. There was an incident last night, I believe.
Yes, I mean, our staff come to work to do a good job. They want to save people's lives, look after very sick people. And sometimes the public don't realise that, although they're maybe not seen in the front line, they're in the back, in the A&E department, looking after very sick people, like I said, saving lives. And some members of the public became very aggressive, very abusive and threatening to staff, which was very upsetting, not only for the staff, but for other patients and relatives who were waiting in the waiting room of the A&E to be seen. And I think we have to say this is totally unacceptable.
When you say abusive, what exactly do you mean? Was this shouting? Was this violence of any sort? What are we talking about here?
It's a mix and match. Last night was primarily shouting, calling names, using foul language that you shouldn't be using in public or anywhere. There was no physical attack, but staff feel very threatened. And as a result of that, it's very difficult for them to do a job. But also it's very frightening for some of the other patients and children who were in the A&E department. So the message is we will not tolerate it.
Well, you say there have been a number of instances, so have any of these cases been reported to the police?
Not to the police. The staff have managed it very sensitively, because what the staff are trying to say to the public, please, we want to work with you. We're here for you. We don't want to have a relationship with the public. So to date we haven't, but I'm giving out a very strong message to the public. We want to help you. We're there for you. We're also there for our staff. We will respect you and you respect us.
In your statement this evening, the GHA has said that they'll continue to enforce its zero-tolerance policy.
Yes.
How exactly does the GHA have a zero-tolerance policy if none of these cases have been reported to the police as of yet?
Well, when you look at the zero-tolerance policy, it really is depending on the level of aggression and violence we have. And I think what we do is measure with the staff, if they're in a situation where they are physically attacked or physically feel threatened, we'll get the police. But I think our staff are trained as well as how to escalate situations. So the staff themselves felt, look, we don't want to go to the police on this occasion. We've managed it. But the message to want to give out is we will not tolerate it much longer.
Well, going forward, will you be reporting cases like that of last night, or will it only be cases of a more violent nature, as you've described?
We will be reporting cases like last night to the police.
Okay. Now, moving on, in your statement, you also mentioned using services from the GHA properly, for example, not going to A&E unless you're in an emergency. Could the public be finding it difficult to access the services they need, the appropriate service?
Last night was not about accessing the appropriate services. Last night there was sufficient staff on duty. Staff are very busy. I can understand how people get frustrated because, as I said, if you come in with a very minor injury and someone's in major trauma situation, we have to deal with them. Services are there for the public, and I agree as a new Director General, and I think when I met with you the last time you were asking me what would I be doing in my first kind of week or 2 weeks. And I think what I want to do is actually look at how primary care, emergency services are joined up and listening to the public. And if they're saying it's not working, and I have met with some public groups who said, look, we do get frustrated not being able to get into a primary care appointment when we go to A&E having to wait. We need to do something to better communicate this out to the public. But also I think we, as a GHA, have to look at how our services are provided, where we need to change and maybe make it a little bit more customer friendly.
Right, now before you go, we did also hear this week that the GHA operating theatre has been moved to Amber Alert.
Yes.
So that means that some operations will be getting postponed. What would you say to people who might have been expecting to have an operation and now concerned about this?
I would give my sincere apologies. Unfortunately, COVID, we're not protected from COVID. And in the morning, we have everything ready to go to theatre and suddenly some of our staff are all sick. They have to self-isolate. And it can happen at a moment's notice. So my greatest apologies to the public. We don't like letting anyone down.
Can they be confident they'll hear back on these operations soon?
They will. What we're doing is starting to review all of our waiting times and try and fast track as much as possible.
OK, Dr. Patrick Geoghegan, thank you so much for joining us. The Director General, Dr. Patrick Geoghegan, speaking to us there on the recent acts of aggression towards some GHA staff.